April 18th, 2024 meeting of the Monroe County Health Board to order. And first thing I noticed, we do have minutes. Did we ever approve minutes from
December's in there.
December's in there? Okay, it's this big file. I haven't had a chance to go through it. Okay. So. Everybody read the minutes?
Some of
From
these,
the February 27th, 24 meeting, well, from our last meeting.
there was a delay in some of these because of.
Yes, yeah, I understand.
Yeah.
Then if everyone's read it, I would accept a motion to accept the minutes.
Second.
Is there discussion?
No, that's fine. I didn't see the minutes until, just now,
Okay,
but that's fine.
Do you want little?
well, you're perfectly within your bounds to have a look at them if you'd like.
It's fine.
All right, it's been moved and seconded to accept the minutes. All those in favor, please say aye. Opposed?
Is that both sets or
This is
just the
just
one set?
February, yes.
That's the one.
Yes, for February, not December yet.
So
Okay,
we're-
I'm gonna abstain from February since I wasn't here.
Yeah. Okay, so noted. Tina abstains, but she wasn't allowed in. So we didn't have a virtual option, that's what happened.
Yes.
Sorry. All right, December 14th, 2023. Did we have these prior to now either? I don't-
I thought we approved them last time, because we went back and, oh, we did last time.
Oh, we did, okay. I didn't actually remember if we did. Fine. Great.
Doesn't
We just didn't have a copy of them?
Because then it doesn't appear in our minutes.
I know, that's what I was just checking in the minutes, but we went back and we approved several months in arrears for some reason, and I thought December was one of them, but you're right, it's not
It's not
reflected.
in there, so we may as well,
It's not reflected.
I'll move to approve the
Yeah.
minutes from December.
Thank you. I was gonna ask for a
Second.
motion.
I'll abstain since I wasn't here
Okay,
for that.
sure. All those in favor of approving the minutes to December 14th, 2023?
Aye.
Opposed? With one extension. She was absent, or not, actually, not a member.
Not a member yet.
Yeah. Okay. Moving on. We'll move right into the school liaison report. Lisa?
Behind you.
Right here.
I do want to say that, we just received this information, 2 days ago? Is that right?
Yeah.
Is that right?
Yes.
So Lisa's here to present this information, and we have a chance to ask some questions about it. I think there are some possible issues with funding some of the things here because of what we're allowed and not allowed to do with funds. And so we're not really here tonight to approve this. We're here to consider this. Probably we'll need more time.
Isn't that in the new,
And I think that's what your expectation was.
Isn't that a new business?
that looks like
Do
number
you want me to do
5.
my report?
Isn't
first
she
and
just
then
giving
talk
her
back?
report?
Oh, yeah, okay, sorry, yes.
Yes.
That's, yeah,
So general report, just thinking
I
about
knew that.
the first 3 months. Spring is the most busy time in the schools where all the outreach happens. So on my end, I've been working with a lot of partners getting in the schools, doing communicable disease education, dental health education, bike and helmet safety education, as well as partnering with some Ivy Tech, IU Health to do more tobacco and vaping with younger grades. As we're seeing the onset first-time use be younger and younger, we want to make sure that we're getting in the elementaries so students are aware of the harm and the impacts of tobacco and vaping on their lungs, on their health, and other aspects of their life as well. So we're doing that in third grade, starting next week, and partnering with respiratory therapy to come bring kind of that clinical side of it as well. Have been meeting quarterly with the school representatives, whether that is their school health services director or the building or the principal of the schools as well, and just making sure they have opportunities for professional development, for conferences, just to better their own education around health and wellness and then their content area as well. So the schools have been quite supportive and excited that we've been able to use the funding to help their own skills so better treat and educate their own students as well. In terms of upcoming education, MCCSC is hosting their district-wide wellness event, so use some school health liaison funds to purchase some items to give to families related to chronic disease. So a lot of families may not have spacers for their inhalers. We've got thermometers, and then a lot of other community partners coming as well. So help with the recruitment of those vendors to make sure that all sides of health is representative. So we have prevention to gun lock safety, mental health, making sure that families have the information they need to get connected, to get referred to services for themselves, for their children, and just better awareness of the resources we have here in the community as well. And then I think that's the most of it. Just providing technical assistance anytime requests come up from teachers, from principals, from department heads. Examples around, for example, when we had the fentanyl death in the community, how can we get more awareness into the schools early age again? Just that awareness piece about dangers and risk reduction strategies for that. Making sure that any outside group that comes in and wants to do education in the schools, kind of serving as that vetting avenue for them to make sure that they are best practices, make sure that the information is relevant to the schools. An example of that is there's some new distracted driving education for young people, right, elementary up to high school, as well as parents. So getting those resources connected to the school so they can take advantage of those opportunities as they see fit, as their schedules align as well.
So this month was Distracted Driver Month. Next month is Bicycle Safety Month. I don't know if you've got all of the things from federal transportation agencies. Would you like me to send you?
So we use a lot of safe routes to schools information. That's a grant that we've had in this community for a
Yes, for a
while.
long time.
Yeah.
I'm asking if you'd like for me to send you also all of the things that are coming through for Bike Safety Month.
Sure, yeah, definitely send it, because we also give the students, in addition to a helmet, we give them a packet to take home, so they can do that education. Make sure their parents in their household know how to properly fit a helmet, and that would be good education to include in that packet as well, that we can send home. So yeah, that would be helpful, thank you.
How many helmets is there?
Close to 400 that we're giving out. So some of them we're able to get free from Department of Health, and some of them, they didn't have enough sizes to give us, so we use some liaison funds to purchase those as well.
Do they also get lights?
Don't give lights, so if you have any resources, that would be a good, or a
The
reflector
city
type of
used
thing.
to, unfortunately, they don't anymore that I'm aware of, but
Or in the fall, we participate with a number of schools on Walk to School Day, and for that, we provide reflector keychains, at least to put on backpacks, and we say that they can connect that to their bikes as well. That's definitely a need too, as well. Any other questions? School health stuff?
I have a question about the agenda. If we need Lisa for the new business about the school requests, is it possible to move it now so that then she can
Thank
go
you. I
home?
was gonna suggest that myself, since I already
And I
brought it
have-
up.
I have Lindsay's report too, so I know I'm gonna be here for a little bit. I'm happy to jump to that if that makes no sense.
I think we were moved into quarterly. However you want to do that.
Why don't we do this, since Avery is here for the Quit 2 program, why don't we so they don't have to stick around, and then maybe we could go back with Lisa, and then she could also wouldn't have to stay for the whole meeting. Anybody have objection to that?
No.
Yeah. What, if you knew how many changes there were to the agenda and how many things we had to include.
Chuckle away.
So is that okay with you?
Then we just come back?
Yep,
And,
that works.
okay, that way, we don't keep everybody else waiting. Avery, would you like to?
Here's, if you guys want to pass around, some brochures and flyers for the new program. These are also just references.
Hi, I'm gonna go ahead and introduce you to Avery. Avery Thomas is our community health specialist, and she does our participation programs as well as our MRC. She's gonna talk to you about the program today. And that was actually something that we began after the baby and me funding. We were aware that the state was gonna stop funding the baby and me program. We'd actually been doing that since 2016 with the grant that we got from the MRC, and then we transitioned to the ISDH grant. One of the things that we were considering when we were looking for what to do next is with Airbnb, it was a very black and white program. They were offered 4 prenatal visits, but they had to stop smoking by the time of the 3rd visit. And if they didn't stop smoking by that time, they could not participate in the program. So that was a place where we lost a lot of people because about that theory of change, and that people are not always, believe it or not, ready to change when you want them to, right? It doesn't happen that way, right? And if you don't catch them when they're ready, sometimes you're gonna lose them. So we lost a lot of people between that 2nd and 3rd appointment. So one of the things we wanted to build into this program was a chance for harm reduction, so that we could keep working with them and work with them until they're ready to change, and support them in all those little successes, even if they weren't ready to quit smoking right when we were looking at it. So that was a big thing. We've already seen a lot of progress so far in Quit for Two since we started it in January. We're going to have a lot more people stay longer in the program. And so we are hoping that it's going to build healthier families. We know if we can stop the moms from smoking, that's going to help other people if they're smoking in the house, and then kids are a lot less likely to start smoking if the parents don't smoke. So that's going to improve the health of that family for generations.
Thanks, Kathy.
Yes, hi, I'm Avery. So kind of just thinking about how the program was built. It's based off of the stages of behavior change and also the counseling approach of motivational interviewing. So all the session materials kind of have MI in them. And primarily referral wise, we're a part of the Growing Healthy Families referral network. And so we're primarily getting all of our referrals through the IU Health OB network at the pregnancy intake appointment. They're asked about tobacco use and if they are currently smoking or vaping, or if they are recently quit, and they get referred to us with patient consent, and then I contact them to see if they want to enroll. But also collaborating with Nurse Family Partnership, Family Vitality, WIC, Healthy Families Indiana, to kind of also get referrals from them. I get a lot of duplicate referrals. All of the moms seeking prenatal care in Monroe County are primarily through the hospital now, since that's where the OBs are. And then I just included a brief overview of what the session materials for the prenatal sessions and postpartum sessions are. There's 4 main prenatal sessions, and then depending on when a mom enrolls, if she enrolls early, she might have more sessions than if a mom enrolls later. And so the rest of her pregnancy after those 4 main sessions are kind of just supplemental, focused on what she still needs support in. And then the postpartum sessions are a lot about relapse prevention, as well as just other general health education, kind of working on the fact that we already have a relationship with them, and so trying to build in other health education components as well. Mental health, postpartum nutrition and fitness, things like that. And then I gave you some numbers about where we're at since the program began. We've received 65 referrals to date this year. Currently have 21 participants, 16 have enrolled and completed at least 1 session. Some are up to session 3 right now, and then 5 have scheduled the first session. And then 3 others have expressed interest of those 65 referrals. we're also still enrolling partners. So if a partner is smoking or vaping and interested as well, they can enroll too. And I provide education to the partner as well. So we have 3 partners enrolled. And then of those that we're currently seeing, all are vaping, except for 1 smoking cigarettes. So that has changed a little bit over time. And then just providing some data, I collect a lot of demographic data on the participants as well. So the education attainment level, primarily, most have either not completed high school or just completed high school. So kind of reinforcing the importance of educating our high schoolers on the risks of smoking, vaping, and then also the program. So we have some outside county moms in the program. The criteria is if a mom is seeking prenatal care in Monroe County, then we can see her. So that's some of the county data. And then as well as 43.75% of enrolled moms did report having previous pregnancy complications, preterm delivery, low birth weight, some of the things already associated with smoking. And then 72% of participants are enrolled in Medicaid or HIP. And then the last slide is just some background on program relevance based on work outcomes from IDOH data. Monroe County still remains higher than the state average, and Indiana still remains higher than the national average for smoking during pregnancy.
Do you know what the national average is?
I do not know the most recent national average. I believe it's either 8 or 9% in the 2022. 2022 was the most recent that IDOH had.
Avery, since most of your participants were vaping instead of smoking, did you find that the attitude was because they thought it was safer?
Yes, I think there's a lot of misconception that vaping is a way of reducing harm. Especially since most of the women I'm seeing right now are younger aged. And so I think high schoolers are vaping a lot. And so there's just an attitude that it's completely safe for them to do. So
I'm curious, you're doing it with the obstetrical program here. Are you also reaching out to the midwives?
So I did go meet with like Tandem. I'm not sure if you're familiar with them. They have 2 midwives and also doula services. And so I got connected with them, but trying to connect to any other agencies around. So if there's specific people that you could put me in contact with.
I'll see what I can do.
Yeah.
That was really good, thank you, Avery. I just had a thought about, did you find any evidence-based programs that use incentives? Because I wonder if we have the ability to offer incentives if we increase participation.
Yeah, so we are offering incentives. We are not purchasing them. We're partnering with IU Community Health. It's coming from money from the Nurse Family Partnership budget. So we're giving diaper incentives. And there's kind of a flow chart we've created. In the baby knee program, they got $25 diaper vouchers, which were expensive to maintain. But diapers are given either based on when they've quit or if they've shown improvement criteria too. We wanted to kind of incentivize them showing up, them cutting down, setting a quit date, the intention of quitting by pregnancy. So even if they haven't fully quit, they still get diaper vouchers towards the end of our prenatal sessions.
Thanks.
Yeah.
And do you have, I guess, education, obviously you have educational criteria for the program.
Yeah.
How are you measuring sort of the comprehension of the safety of vaping and smoking and the understanding of how important it is to that baby's health and to their health and the whole family's health?
Yeah. Mostly just based off of their engagement in the conversation, their willingness to, I have some moms that are still showing up but seem firmly like, oh, this is fine to keep doing. And then on the other end of the spectrum, moms that are like, I want to quit as soon as possible. I just don't know how to get there kind of thing. I think broadly, once some of them don't know of any risks, some of them are aware of the risks, but still doing it. So I think, but when I communicate the risks, they seem to comprehend that and comprehend that it is a danger to them and the baby. I haven't really experienced someone being like, well, I still don't believe there's a danger or anything like that.
And I understand what it does to the children in their home already. And
Yeah, I think vaping is a challenge for that too, because they're like, oh, they're not, they think cigarette exposure and vaping exposure is different. So I try to really lean into the fact that e-cigarettes are not well researched yet. And so we need to kind of see it in the prevention aspect of, because we don't know all the implications of e-cigarettes, we need to do our best to at least treat it like cigarettes as well. Yeah.
Any other questions for Avery? That was a nice presentation.
Yes, thank you.
Yeah, thank
I
you.
learned a
Thank
thing or two. All right, Lisa, let's go back to your school proposals now. So, you want to address those?
Sure. So, as I meet with the schools and as they have needs and wants, I try to help them as I see fit in a way that is doable kind of within my fund, but sometimes I'll get requests for things that are beyond the scope of what my role does or beyond the funding limit. So in some cases, I'm helping them write grants or seek external funding. And two that came up recently, both from MCCSC specifically, but one has implications for maybe full county. So I just wanted to kind of go through the process of opening up the conversation to see what things would be funded or not. So the two specific requests, they are looking to pilot telehealth services in their schools. And so within our PEDS group, you have the option for same-day appointments, and a lot of people can get in quite quickly. However, it comes down to transportation and scheduling for a lot of people, whether they can't get off work, they don't want to miss school, or transportation may be a barrier. So the Health Services Department is looking to reduce those barriers to care. So they engaged the pediatricians in a conversation to see if they would be willing to try out telehealth services in the case of the RN at the school with triage, see if it's appropriate type of appointment. If so, get that appointment with adults, permission, and then have the tools where the provider could see in the nose, in the throat, in the ear, and then call in a script or do whatever the next step of care would be, eliminating the need to set up another appointment. So with that idea is, of course, the need for the equipment. So one-time funding fee to purchase what's called, they're calling it a kit, right? Like a carrying device that has all of the technology needs and the accessories to go with it to conduct those appointments. Beyond that one-time expense, everything logistically would then be handled kind of with the current billing and insurance as you would go through if you were a PEDS patient already. And so there wouldn't be any additional cost to sustain this. It's just a matter of getting the equipment. So reducing kind of barriers to care and issues with getting appointments for kids. So that's the first one, if we want to pause there and have questions or conversations around that.
And it looks like this is the information about it?
That's the other one.
That's the other one?
Yeah. So
Okay.
there's one specifically from MCCSC. Well, one is more kind of from me as information.
Lisa, what happens to kids that can't pay, families that can't pay?
So within PEDS, I know they have social workers on site to help with those situations. And I think that's something that they would have to figure out how to kind of market and meet the needs of the kids who maybe not be insured. I know they work closely with agencies like Covering Kids and Families and insurance navigators to get them connected to care. Yes.
Thank you. To be sure I was looking for the right one.
And so that would potentially have to be something that they have to figure out, because I know some patients aren't seen by Sick Riley. They go to like Health Net or other agencies as well.
You know, the two FQHCs here, the Health Net and Centerstone Health Services.
Yeah.
So if they're going to, if the physicians are going to bill to see the patient at the school, I mean, it seems to me, I guess you all are asking for money from the health department for the equipment.
Yes.
So it seems to me that that would not be our role, I would not think. And so for the Indiana or First Health funds, I mean, our ultimate goal is to gather the data and statistics we need to meet the criteria to continue to get the funds. So is that, I mean, that, I don't know what that really gets us in terms of,
Well, about the billing, so I've reached out to the state. I haven't been able to establish a meeting until next week. But I do not think that we can use the Health First Indiana dollars to then, for IU Health to bill and make profits
right,
off of that.
Okay.
And it sort of seems, to me, it seems, if they're the ones doing the treatment, why aren't they providing the equipment? I mean, I'm just asking.
Right.
I'm not
And-
saying I'm for or against.
Yeah, and I think the initial request is MCCSC was trying to put up, you know, they don't have the funds at this time, but with it being, it would be a need on their end to come up with it for the partnership to be able to be created in the first place. And so MCCSC was seeing what they could acquire for this to be feasible.
I mean, I see the convenience of it, and certainly it would provide access to some kids that don't get transportation, or their parents can't provide it, or, but I also see the other side that something else that's really health the health level increases, you know, that reaches one of our goals, but it's not us that are providing the treatment or benefiting monetarily from it. Not that we normally do benefit monetarily from our treatment, from our programs, but I mean,
And I think-
you see what I'm saying?
Yeah, and I think they would be open, of course, to any partnerships. I think the initial thought is keep the kids at their medical home and not see kind of other providers and just think about kind of continuation of care. So if they're already established, it helps just keep that per se. I think we're in a unique situation too in Monroe County that there's only one pediatric group for the most part. So most students who are established in care already see those providers too, but.
And on the budget, I see there's a total here for 2 kits and then another total for 8 kits. I know the difference between the number 2 and the number 8, but programmatically,
Yeah.
what's the difference between 2 and 8?
So MCCSC ultimately would like to get 10 kits total because they have 10 RNs that are kind of scattered or assigned throughout the district for the 21 buildings. And so the best case scenario is every nurse has a kit, and so you don't have to track it down and go find it when you need it. 2 kits are already going to be funded by MHS, and so they have 2 to potentially launch and get things started. They're just seeing possibility of expanding that so they can have more kids.
Thank you.
And well, SRP may take care of a lot of the children. There are also not only individual family physicians in this area. Monroe County Hospital also has a group of family physicians. There are individual physicians. So saying that it all really falls to one group to cover the children in this community seems incredibly narrow and like we are kind of driving into one particular bay of this big garage. And there's just something, especially if IU is not simply doing this out of the goodness of their heart and wants us to buy this equipment so that they can bill, I am really uncomfortable with that.
That's fair.
Well,
Do we want to move on to the next one?
yeah, we have, and certainly this warrants some further discussion, and again, we only had a short time, so it's not I just think it's something we need to.
Yeah, no, and this is helpful for me to understand too, as these requests come in, to kind of see the scope, and with public health funds being new, just understanding kind of where that scope and where those
And
boundaries
if we
are.
have more questions, do you want us to just send them to you? To
That
send
works,
them
and
to
I can kind of field them,
everyone, or?
or kind of send them to Lori, and Lori can field them
Yeah.
to me, if that makes sense.
Sure. And
I
then
can send them on.
if the answers seem relevant, I can send it to the rest of the program.
Lori needs one more thing to do anyway.
Of course.
You're fine to email them to me directly.
Yeah,
It's easier.
And if,
Yeah.
if the answer seems relevant, I will send it to everybody else on the board. How's that?
Do you have an idea of what we're talking about in terms of expense for that equipment?
Yeah.
So
It's
on the second
Yeah.
page,
Basically, $115,370.
so kind of the two minimum requests, best case scenario,
This is the 8.
yeah.
This one.
Yes, I saw that. Thank you so much. Yeah.
This one's so confusing.
Okay, did you have any further discussion on the telehealth before she goes on to the
The other one.
other issue? If you're okay.
Okay, and the next one is one that MCCSU specifically learned about recently and asked, of course, hey, do you know where any funds are for this? But this one I saw as potentially having impact for all schools in Monroe County. It's just a matter of if they want to opt to use this or not, but I thought first step would be to see if this type of funding could even be used for these type of things. So I appreciate you all just looking and, you know, considering as we're kind of learning these things. So this one is specifically for software. If you are in the health office of typical schools, you're using student, what's the technical term? I'm forgetting the technical term, but it's like a Skyward, where you log in, you see your student's grade and their identification and who's their teacher and where their schedule is. There is a health section in that, but it's not built for health services. They have to build their own codes, they have to build all their own platforms to work for them. And then there's a huge opportunity for kind of not consistency with use with it as well. So August schools was designed specifically for school health and mental health providers to be almost like an EMR type system and be a little bit more clinical in nature. This is a platform that can run a lot more analytics and a lot more data, and even prompt those providing care to do certain steps. So when you go into the schools, not every school has a RN in the building. Oftentimes it's a health aide that is trained, which they are wonderful, skilled individuals, just not having the licensure, right, to go along with it. With that, right, and depending on who trains them, again, just the consistency of care can differ. And so one example, when I walked through the kind of platform with August Schools representative, let's say a kid comes in with a head injury. Instead of leaving it up to that person to decide if it's bad or not, or remembering what to do for those, it pops up what they need to do to work through that head trauma incident and who to report to, how to send information to teachers, to families, et cetera. So just streamlining communication, increasing the opportunity for just more accurate reporting. It builds in communication pieces to family, so if they can send something specifically to family right away, digitally. Right now, I know in a lot of schools, you get the just incident report kind of handwritten, given to the student, and hopefully it makes it home in the backpack. So improving communication kind of among all staff, being able to run analytics. And one thing when I was meeting with August Schools, they said if we were to fund this, say for multiple schools or different school districts, they could build us almost an administrator role where we don't see the data of the kids, but we could pull the reports, we could run them to see what trends are happening in the health offices, what referrals are made, what those demographics are of the students coming to the health office. Yeah.
This looks to me like a FERPA issue waiting to happen.
So it is HIPAA and FERPA compliant as well.
So everybody has to get trained, right?
Yes.
Even all the school personnel.
Correct, yeah, and they would.
In FERPA and HIPAA. And
Yep, and that's something that the staff typically get as well. One nice thing about this specific platform is they would provide that training, the onboarding for all schools before launching this as well. And they also have 24-hour technical support, so ongoing throughout if there is any issues with the platform. And it does link to whatever school platform that district uses, so whether it's Skyward or something else, it does connect with that as well. One major thing when I was speaking to the nurses about why do you want to use this, what's so great about this, not only just making sure they're maintaining care and being able to chart and run those reports, but one thing is around immunization, record keeping, and just getting those records from parents and running those reports. I don't know how it does it, but instead of giving the nurse the record and they have to hand enter it in through chirp and everything like that, it just, they can scan it in and it automatically somehow reads it and puts it in beautifully and tells you about if they're in compliance or not. So just keeping track of immunization status of kids seems like it's gonna be quite easier on a platform like this.
Are the algorithms designed for professionals and then algorithms for the non-professional?
So it would
Are they built in that way?
It's built in that anyone can be trained to use it, whether you have that kind of credentials or not, because they want to reduce error, right? So whether it's dispensing of dispensing of medication, they're going to give you flags and alerts and make sure you do all the correct checks before handing out that medication. So taking some processes and kind of modernize them or making sure there's record keeping around them as well.
And this requires an ongoing subscription service for future years?
Yeah, this one would be ongoing.
Oh.
Yeah. So this one is a big ask. And I don't know, I assume there's probably other platforms out there too. This is just one that got brought to their attention recently, that seemed very kind of honed into their specific niche.
I was gonna ask if there were other comparable software systems that we're aware of at this point.
I don't think they've explored others at this time, because this seems to be, just one that seems to fit their needs at this time. But we could request to see if there's others that they've scoped out, points for.
And as we saw in Gateway, they have numerous grants at their disposal. I'm wondering whether they have looked to other agencies such as Robert Wood Johnson to help fund this rather than just looking to us to fund this.
I think at this time, they just wanted to see if this was something that would be considered before going out to those other agencies.
And the other question that I really had was whether if we put any of that money forward, whether the schools themselves, particularly since MCCSC seems to be the one you've been communicating with, if they plan to match at least whatever money we would put forward.
I think that would definitely have to be a conversation, especially around sustainability, right? Like if this gets funded year one, what's planned for year
At
two?
$100,000 a year,
Yeah.
it would have to be met at least.
And again, I think the thing that we have to consider is this expenditure within the scope of the Health First monies? I mean, we would have to, this would have to be vetted basically. In other words, to even consider it.
Yeah, and that's, again, I just wanted to see, is this something that is worth or not?
Exactly.
And I didn't bring it up to any other schools because I didn't want to get them excited or tease anything out before talking to you all.
And we saw 11,000 students within the system, at least that's what I remember reading.
For MCCSC, yeah.
How many student visits is that per year? Do we have a number for that?
They do have a number, I don't have it in my head, but I know that is something they track on a regular basis. Because I think it helps them with staffing ratios too, of what
Sure.
buildings need what staff on hand, and what schools need extra care depending on students' conditions as well.
And yeah, I'd be really curious if we can get that information, plus not only how many student visits, but how many actual students,
For sure.
you know,
Other
individual
visits, yeah.
students.
Because you're gonna have frequent flyers
Oh, yeah.
depending on.
Absolutely.
Yeah.
I mean, just menstrual cramps alone,
Yeah,
you know, a girl who shows up every month.
Yeah.
So I'd be really interested in those numbers
Okay,
when
yeah,
I'm
I can
looking at this.
ask if they could pull those and provide those as well.
And then we're also using public funds to private schools, and private schools are 8 of them at 6,000 apiece, right?
Well,
It's like 48
here's,
grand.
here's
That
my
would be
question for
huge.
her, which gets to that. Is this like a Chinese menu? Like, in other words, if we found out this is an allowable expense, we don't have to do all of it, right? We could, for example, say, we only have enough money to do MCCSC. Everybody else is gonna have to figure it out.
Yeah,
So
I just wanted to give the big picture
that,
in case
thank you,
everyone
thank you.
did.
So that decision could be made if it's allowable. And then I just also want, if I were in CCSC, I would want to make sure I talked to a couple other schools who are using this software before I committed. So,
Just to make sure it's not just new and shiny and,
yeah, new and shiny, make sure, see what their experience is with it. Does it really have all the bells and whistles? And it looks I think if this is an allowable expense, if we decide this is something we want to do, I think we would benefit from the data. I think the data would be.
Yeah,
Yep.
I think Lori said that she has a meeting next week, right, with the state, and she'll ask specifically about some of the things mentioned in the non-allowable category is hardware, computers, laptops, cell phones, blah, blah, blah. It doesn't say anything about software. Also doesn't say telehealth, but that would, what they're basically asking for is hardware. So we'll have to see whether it's allowable.
so I'll give you office data and kind of those breakdowns. Anything else that'd be helpful for this to have? Did you work through this?
I think it,
I think really the questions are more on our end.
Okay.
At this point.
Yeah.
But in the telehealth budget, there was hardware, there were
Yeah,
tablets.
that's right.
Yeah,
Yeah,
so we can at least say right now, we know that's not
Okay.
an allowable expense.
whether everything else would be.
The software part of it might be depending on their answer, but we at least know right now the hardware.
Well, Lisa, you brought us a couple of interesting things, good discussion. We'll
All you
just
can do
have-
is ask, right?
That's it.
Not afraid to ask.
You're not gonna get it if you don't ask.
Yeah.
Thanks, appreciate it. But we'll have to, set the check and see if this works, if this fits in within the scope of the law. And then then the next thing we have to decide is this something that we feel we can do and how much of it. Okay, any other questions for Lisa at this point? Lisa, you're free to escape. I mean, we are fascinating, but it's.
And then I failed to send my quarterly stuff. Do you want me to just send it to you and you can disseminate it out to the group? I put it in a copy, but I forgot to send that ahead of time. Sure. Thank you.
Thank you.
Thank you, thanks, Lori.
Can I squeeze behind y'all?
Or Lisa, I just have to call you Lori. Lori's next.
Okay, so just provide a few highlights over each division. Just a few things that I'm currently working on and going to be working on over the next few months. The Health First Indiana budgets for 2025. So those will go through a few different steps, again, until we know what those final award amounts are. But the first submissions will be due in June. So we'll need to have a draft of a budget for the May meeting. The state is using a system to where everything's just going to be essentially tabulated into their online system. So changing from how they were doing it previously, but that's on the budget end. Working with the Indiana Department of Health on our health plan. So that's not required by the state, Indiana Department of Health, but we are required by law to have one. So met with an individual earlier this week to start drafts of that. And we'll be able to bring some of those drafts to the May meeting as well. And then working with subcommittee groups with the Indiana Department of Health, focusing on, one group is focusing on obesity, and then the other is maternal health. So looking at creating some strategic plans with targeted goals at 1, 3, and 5 years that then can be taken to legislative group. With disease intervention Matthew is attending DIS Day on April 12th, or he did attend. Received trainings and programming updates. They have been training Positive Link employees to do level 1 DIS work. And syphilis and HIV cases are continuing to keep them very busy. With environmental health, general environmental, so as of April 5th, they have conducted 65 radon tests. They have an additional 40 scheduled for April and May as of April 5th. So staying very busy with that. They're working with the county GIS division to develop a tick collection field app and dashboard to be able to show some reports on that. They're beginning mosquito trapping in April or May. And they have built tick drags and will begin those collections in early May. With foods, some of the highlights for the month of March, just winding down licensing season. Jeff and Mike attended a foodborne illness roundtable with emergency response and the Indiana Department of Health. And Alyssa attended the Southern chapter meeting down in Evansville. They are beginning to train Peter, who is the part-time specialist. He's going to be cross-training in foods to do level 1 inspections, and he's currently been helping in the septic division. Let's see. With wastewater, Shai is going to be doing an event with the Friends of Lake Monroe. And they are contacting homeowners to request quotes for septic repair program to send those to county legal department for review and approval. Population health and outreach, they have started their community health assessment focus groups, so doing listening sessions around the community to gather input and information to develop the community health assessment. Avery told you all about the Quit for Two program. Let's see. With the MRC, Avery attended the Beat the Heat implementation meeting and a virtual tabletop exercise relevant to the solar eclipse. Public health preparedness was busy primarily the month of March with preparing for the solar eclipse, distributing solar eclipse glasses, social media messaging. And vital records, Jessica, who just recently joined the Fetal Infant Mortality Review Committee, attended her first meeting in March. And all vital records employees will be attending the spring conferences in April and May. So those are my primary, oh, yes, yes.
So at our last meeting, we spoke at length about DIS in the jail. And you were going to meet, I think, either with Sheriff Marte or with someone in the jail. Can you tell us what has happened and any update that any of you want to share with us?
Well, in short, we haven't.
Okay, that was fine.
Yeah, sure. I believe you put out a feeler.
Query, yeah, got nothing.
Yeah, I got nothing.
But with whom? Who did you?
The jail commander.
So have we gone back, since our attorney who was present said they were highly amenable to meeting, have we gone back to the attorney and said, you know, why is it we cannot get cooperation? I'm just wondering.
I think my thought on that is that we had a couple other issues that
Sure,
were
I get it.
consuming a lot of time.
Yeah.
And we haven't gone back, but probably we should, you're right, we probably should make another request. And this time, if it goes, it just isn't responded to in any way, then maybe make it a little more formal.
I did some subsequent looking at that, and I think we gotta go direct to the sheriff instead of the commander.
That's what I was wondering, if we went to Sheriff Marte and said, the health department sees this as an issue. And see if he will listen.
I'll follow up on that.
Thank you.
Question about hardware. Anything new on the ground penetrating radar for the septic folks?
I would have to, talk to Cheyenne about that, but that's her.
Yeah, we had, I signed the,
Oh, the XRF?
yeah,
They have used that for 2 lead inspections now.
And were there any eclipse events? I mean, other than the event itself?
No, it was actually pretty quiet, so the EOC operated, I was there from about 8 to 5, but really pretty quiet. Traffic wasn't bad. There wasn't a whole lot going on. And so across the state, most of the EOCs really kind of closed out early. So.
All those signs about filling your tank with gas.
No,
Sure.
don't use your phone.
Scared everybody off.
groceries, there was not a milk or loaf of bread to be found.
I know, it's so basic. It was
Why
like,
there's sudden
but there was
consumption.
toilet paper this time, so
Yeah, there's a lot of toilet paper.
we've made it. Yeah.
Yeah.
Okay, so do you want me to touch on this?
Yeah, just touch on it and see if
Um,
there's.
Sure.
Yeah.
So just formally drafted a brief overview of the health department cross-training plan. So this just kind of outlines some department goals with continuing the process with employees who already are engaged in cross-training, and then starting the process for those maybe who are new or haven't begun any cross-training, with just some deadline dates there to be able to have a more consistent, clear focus on expectations and then meeting those cross-training deadlines.
Are you getting pushback or people coming in understanding this is the expectation? And is that making it easier?
Yes, so I do think that we have a lot more openness, eagerness, kind of across the board. And really, it's a great it's great for employees too, just to have those additional skills and individual employee development. So each employee has their own development budget for this year. So money isn't a factor. They have the money available for the additional training or certifications that they may need to develop these skills.
Well, yeah, and to answer your question, yes, there was previously, there was some pushback about it. I, like you, never really could understand why, because it would be to everyone's benefit if they were in the department that had to be shorthanded,
Sure.
that they would want someone else, would want help. That just makes sense. And of course, it just makes sense anyway. I'm glad to hear that there's seems to be a better attitude about it, because just, do you feel that you need additional support, like an actual resolution or something from us, or?
I think maybe that's to be determined. So plan on talking about this more in depth at the next individual division meetings, and then we can kind of go from there if needed.
And do your division heads encourage the notion of camaraderie as opposed to tribalism? When someone is coming from another department to help, that, we are expected to welcome this person because they're here to help us. And I'm just wondering if your division heads all are disseminating that information and expectation to their employees.
Yeah, I mean, I feel pretty good about that. And it's really about more just looking at it from a team-based approach, and that we're all here kind of working together. And it's really just about jumping in and picking up where you can and when necessary.
I think there was some fear too that once one person got familiar with that, then they would be stuck there or, or nudged in and kept there for extended periods of time. But I think the department as a whole is working in at least this is my perception, as a cooperatively, so that feeling I don't think is there, is as much as, at least that's the feeling I get when I talk to the employees.
So there's been a major shift in the mental
Yeah.
approach to any and all of the changes, which is great. Must take some measure of paying off.
Yes, we just.
There's been some turnover in personnel too,
Yes,
so.
exactly. Some of the fossils are gone. I didn't say that.
I didn't say that.
And turnovers appropriate.
Turnover, yeah. All right, any other questions about anything that Lori mentioned here? Anybody have any?
No, I am curious though, and maybe that's someplace else in here. I don't see it. The IDOH visit is that next week?
Oh.
Yes, next week.
Yeah.
Maybe we can talk about that and what you want and need from us.
Oh, sure, for the visit?
Yeah.
Well, I think that they're
It's
gonna
on my
be
calendar.
coming to, I think they're gonna be looking at some of our, what our major successes thus far, what we've gained from the additional funds and what some of the primary focuses are for next year for the additional funds. So any ideas or thoughts around that, I think would be great.
How much net funds has our budget increased? I feel ridiculous asking this question at this point, but it's my perception that some of the funds that the county was providing previously, we didn't get as a result of getting the money from the state. Is this correct? Am I correct in this?
Yes, so the county opt-in amount ended up putting us in a place where the county put in around $1 million less than the previous year. So the funding that we got from the state was right around 1.5 million. And then I think we were right around 900,000 total was the county opt-in amount.
And what is the total budget aside from that?
For everything that
For
we had,
everything?
with grants and everything, I'd probably have to look at those up, but from the county and then from the state, so that's roughly 2.5 million. We had a little bit of money that we could use up from the old state dollars. One of those will pretty much be gone after this year, and then the other remaining will have a little bit of funds.
How much did the Department of Health get from the COVID funds at the state?
I'm not sure how many COVID dollars, but we lost and are continuing to have decreased grant funding from the state. So that's going to be taking, particularly in 2025, a chunk of our Health First money. So 2 of the grants that were COVID funds are gone, and our harm reduction and our HIV funds, grant funds, have significantly decreased.
So the governor's promise to bring us up to a national average per capita funding for health sounds like it's gone.
The commissioners didn't get the memo.
Yeah, yeah.
Or is that council members?
Or council.
Council members, it's not commissioners.
I'm sorry, I stand corrected.
They're the fiscal people.
Yeah.
And, well, see, that's it. I'm wondering if everyone on the board knows that it sounds like we had a big infusion of cash, but net gain with the drawback from the counties, we do not have a big gain. And so it's not like we're just flush with, all this extra cash. And quite frankly, I think that wasn't the intent of this.
No.
I mean, the intent was to supplement what we had. And so to allow park departments to do things that they were not able to do in the past. And that is not happening. To a large degree, to some degree it is.
My impression is the council interpreted that as, here's operational money.
That would be a fairly accurate
Not-
assessment. Yes,
Not extra.
yes.
I wonder if we're unique in that approach
I doubt it.
Doubt it.
and how it will be handled. I mean,
That same thought has occurred to me, Kay, but I don't know the answer to that.
Excuse me.
No, go ahead.
In the budget, so we had to send a budget to the state to get the funds, the 1.5 million. So what, in the line items, kind of, can we get a copy of that? Like this amount, most of it is for staffing, is that correct? So approximately what is that amount? That's around.
Close, I mean, around
That's
a
close to
million.
$1 million.
Mhm.
So the rest of it is for office
Supplies,
supplies and.
mileage,
Services.
contract services.
So we go through the budget at the end of, it seems like the cycle lasts forever. Like it starts in the summer and it continues and continues. So we did all of this last fall, but because you just came on, you didn't receive all those 40 pounds of paperwork with all those spreadsheets. So maybe that could be provided to give her a better
Yeah, that'd be
understanding of what the funds are and where they're going. And then we get to start it all again soon.
And I've asked it multiple times, as health commissioners, do we need to show up at council meetings and talk about this? Because council doesn't know and the public doesn't know because we're not necessarily showing up at council meetings and making a point of the fact that Health First funds were to supplement what we had. And instead, council has withdrawn funding. And the citizens don't know that. Even members of council are rather oblivious and are oblivious to the struggle we've had with saying, we need this position, and they're going, oh, well, we'll send it over and have them take a look. And no, you really don't need that. And there are council members who do not know that we're losing through this risk process things that our administrator has said, I need these people and I need them to be doing this job and they should be paid
Yes.
in par with other people doing similar work across the county. So
Be adequately compensated, and workforce development, which include compensation, is one of the primary goals.
and I spoke to one council member and she's like, well, I didn't know that. And I was like, well, why don't you know that? And she's like, well, why don't you come and tell us? And I was like, okay, I will. So, whether we do it in a cycle, one of us showing up each time and it's not on the agenda, so we get to talk about things that are not on the agenda and just keep hammering at it because it's crazy. It's crazy that we see what's needed and we know that the health of the county is at stake here. That I'm getting off my soapbox now.
Well, I agree with what you're saying, and I agree that we should go make a point of, I just want to make sure that whoever goes, but you really have your ducks in order, and you really know the statistics, you know how much money goes where, and how much we didn't get exactly, so that we can answer questions in a very competent way.
So it sounds like we need bullet points and we can each go and whether we attack different bullet points each time or whether we keep going back and hammering on the same ones.
That would be effective if we had talking points and we each took some. And I'm also of the opinion that any advocacy of that kind is more effective if you have a specific ask. And it sounds like this is all very amorphous, like you're stealing our money. And I would rather have us approach them with a specific, like, for example, we anticipate hiring a whole lot more people. We need the upstairs of the building rehabbed. That's not happening. We talked about this. We have the money, this need, you know.
We had the money.
We had the money, yeah.
We were to have it.
I mean, space, yeah, and, yeah, thank you, because space is still a big issue.
And it's gonna get more of an issue maybe in the coming year as we get more money and we need to hire more people and they don't have any place to sit.
So how does that bullet point presentation get developed?
Well,
It'll need to be somebody who really, really understands the issue and all the funding streams and what changed. Look, I moved in, that person is, I would be willing to do that, but I do not have that knowledge.
Well, the only person has that. The only person
Well,
has that.
yeah, I mean, sure. I mean, I think a big part of my thing is, you know, when you're looking at the big scope of the $1 million essentially that they saved, I mean, they could reinvest that back in the health department with increasing the salaries and increasing by providing those additional, you know, employees and positions, that I think we need.
It probably wouldn't even cost
Mhm.
that $1 million
Right.
to do what we're asking. Which brings up, we just for the sake of time, we probably
Sorry.
should move on a little bit, but let's, the final thing is that let's do, I'm gonna make an action list here. We want to meet with the sheriff. And we want to develop, a talking point list for council. And that's all I need to make, we'll remember what that means. Okay, everybody okay with moving on here to the monthly commissioners
I think
report?
we need to move on. I'm not gonna get out of here.
Yeah. Commissioners reports.
Oh, sorry. So this is just January and February. So every month, just essentially the work metrics that the health department has been conducting is tabulated into a report that's provided to our county officials. And this is just for the board review. This is also some of the information and data that I will be using to submit to the state for our core service metrics. So just so that you.
I just want to say, I appreciate getting that now.
Yeah, I like it. It's easy to understand.
I think it's very helpful and it's very easy to compare, you know, year to year, side by side and see how the work fluctuates.
Yeah.
Last time we had discussed, was one of the nurses, I think, or the staff, that each patient is not getting a blood pressure, that's not their protocol. And I feel like what greater impact for Monroe County, the health clinic, if every single person got a blood pressure taken, because that's going to identify those who need assistance or medications or impact their health. So I'd like to make a motion that we request that each patient that comes through the county health clinic get a blood pressure.
I don't think we even need to move that. I think we can
You're
just,
talking about the Futures Clinic or the Everside?
I think she's moved on to the community health services, right? 'Cause
Yes.
The nurse.
Yes.
Oh,
We were
okay.
looking
Oh,
at this.
over on Miller Drive.
Yeah.
Because when they were here, when we were at the last meeting, they indicated that they did not check a blood pressure on
yeah,
everything.
but I don't think it takes a motion. It
Oh.
just takes a
That's policy, that,
demand request policy that this happens, period.
yeah.
Absolutely.
But this would be for everybody, people who just come in for an immunization
Yes.
or.
Yeah.
I would have,
That's pretty
sort
simple.
of assumed it was happening, just because it's so easy. It's just one of those.
And that's one of the metrics we have to submit. So
Well, that works then.
I will reach out to Lindsay.
Okay, thank you.
All right, health fees update, ordinance.
Yes, so the health fees that we, well, that have been worked on for a while, so this is just the final, actual approved version in the ordinance. So just for your copy and your reference of the current approved health department fees.
Did any of it change drastically?
Yeah, there is. I got it.
No, not a whole lot. Home births increased, a little bit, and they changed some of the, multi-market fees. And, our attorney is on if there's any questions, I guess, about it.
I remember that we had, someone had a restaurant, but they also had a booth someplace, like a farmer's market or something, that we didn't require them to duplicate the full fee on both of those places. Wasn't that correct? There was something that was turned down, but it was misunderstood by the.
Yeah, I think it was when they were charged a fee to have a booth, and then they went to more than one market.
There you go. That was it.
And then they were charged the fee again.
Yeah, the whole fee.
But our intent was they would receive an additional charge, but it would not be what that.
Wouldn't be twice as much.
Exactly.
Yeah, yes.
And so they've grouped it up into a couple different categories to account for that now. Mhm.
Well, that makes sense because there are a lot of different things and food trucks, places where they're selling bread or
Yeah.
even frozen meat and things in the farmer's market.
Okay, so we need to,
This
vote
is,
to
and
approve these. I believe.
they are approved. It was kind of more information.
Already
Okay.
published this.
Good. Yes, as you know, Dr. Britton was having some difficulties, or we were, the county, and he was having difficulty getting professional liability insurance that covered his duties for the Futures Clinic. So we received a letter of resignation, and shortly thereafter, the county decided that they could get coverage for that, and I believe that's enforced now.
It is.
It is. So Dr. Britton has rescinded his resignation, and I think we just need to,
Shouldn't this agenda item have just said, never mind?
well,
Basically, that's
we
it.
probably need
But we never
a vote.
accepted the
Well, we didn't
resignation.
accept it.
Oh.
But it's on record, so they suggested that legal suggested that we have, I don't know.
Dave.
Anyway, Molly suggested that we take some official action or take something and have it in the minutes, I guess.
So what actually happened was that the insurance was always there, we just didn't know about it.
Well, there you go.
Yeah, so how do we word the motion? Because he didn't actually have a resignation.
It was accepted.
Well, I think maybe something like we recognize that Dr. Britton had submitted his resignation and it was rescinded due to a
Clerical error,
an
basically.
error, yes.
So would the motion then be we accept the rescinding, something like that?
Well, we didn't accept the resignation.
Yeah, that's
So that's
the
why it doesn't make any
difficulty.
sense to
That's
make
the
any.
problem I'm having
That was never-
formulating.
Before the board.
Yeah, so.
Let the minutes reflect that we noted Dr. Britton's resignation, although it was never officially accepted. And we also, once the issue of the malpractice insurance was resolved, we accepted his letter rescinding the resignation. Yeah, I can help you wordsmith that.
That's it, that's it.
Covered 72 hours.
Yeah, there you go.
Good job.
Okay, everybody satisfied with that?
Yes.
Okay. All right, here we go. Job description updates. We can, whatever your pleasure is, we can go through these job descriptions very carefully if you'd like, or you can,
So have these been crafted well enough that they may make it through WIS, and we may actually get what you desire?
well,
That's,
Probably not.
yeah. Let me just tell you quickly what the process was, and then you can decide yea or nay whether you want to go through them, which we can do. Is that Lori wrote the initial descriptions, and then the most recent version, she rewrote them and then submitted them to Kim Shell, who is the county council administrator, who is, in my opinion, a whiz kid. I mean, she's not a kid, but she is,
ace,
man, you should see her
wordsmith.
moving things around, and it's like a work of watching a master at work. And we went through every one of these job descriptions, every change, made sure that it was consistent throughout the document and with other documents where that position is described. For instance, clinic manager and director of clinical services, for instance, the clinic manager of the Futures Clinic, that's going to stop being a position. We're going to have a director of clinical services. It has some additional duties, but that clinic manager is mentioned in other documents. She has corrected all those. That's just one
What a
example.
bad job. She deserves a lot.
Well, we spent almost 4 hours
Wow.
last Friday afternoon.
Well, and there were 3 or 4 meetings before that.
Yeah, but this was the last meeting. And then she came back on Monday and made other little corrections in it. So I've seen them. I participated at the level that I'm capable of in that meeting. Lori was there. Molly from legal was there. So she had her input, and Kim. So I feel, and Lori, if you feel this way too, back me up here, but I feel that the jobs are described about as well as they can be. All the duties should be in there, and we hope that WIS will look fondly upon these, but no guarantees. It doesn't mean, that's not the end of the process necessarily, though. If they come back and some of these still aren't changed, then we can take our argument directly to council and say.
I was gonna
"Here,
say,
look."
it's time to march on council at that point, because this is ridiculous.
So the big problem we had last time, this is the same group, and we're trying to up the level, is that was said, you can't just give them more duties laterally, you have to up their responsibility. Are you confident that these reflect that?
To the extent that we can
Confident.
elevate them.
Yes.
Well, yeah.
Okay,
But the council has implied that even if we don't get the full approval from WIS, that they would act favorably, or at least they would consider acting favorably for us.
yes, I remember, but since you've gone to the trouble of doing this, and,
That this is a necessary step.
yeah,
And
so,
even elevating the level of education isn't a guarantee as a requirement for that position.
oh, I don't think.
Still
it's
isn't a
a
guarantee. It isn't a guarantee that you're gonna get an upgrade.
Well, that's another moment when we actually need to march on council and say, our administrator's been going through this for almost a year. We need these positions and we need them now, and you have the funding for this.
Well,
That's
there's
not the
yeah,
issue.
exactly.
You have the funding, you're not giving it to us, and we want this done now. We're sick and tired of playing this game. ridiculous.
Lisa, you're the
So,
newest member.
Are
Can
these,
you-
are
go ahead.
these new positions?
There's one new, which would be an assistant director position for vital records.
Okay, so the other positions, there are several positions for the Futures Clinic.
Mhm.
Those are current positions? Like
Not
the-
the
Director
director.
of Clinical Services.
That is
That's-
new.
Oh, okay, that's
The other
new.
positions
That's replacing the
are-
clinic
have
manager.
people in them. We're just upgrading their job descriptions because they were working outside of their class.
And so how many patients were seen in the future, or seen in the Futures Clinic per month?
Well, we're gonna,
We're gonna get there.
We're gonna
Okay,
get there.
okay,
Yeah.
got
And it'll be in the monthly report. You guys.
Okay.
So can we approve these as a batch? Do we have to approve each individually?
And do we have to approve them at
Do we
all?
have to approve them at all?
I wouldn't think so. I mean, we,
And I would ask Dave.
I would say we're approving going forward.
if we have job descriptions, Dave, that we're going to submit for the WIS process, do we need to vote on these and approve these job descriptions? I was under the impression we had to do that.
Is he muted?
Did he hear us?
I couldn't hear the question. It was cutting out, but if you're asking me whether you need to approve the job descriptions to send to WIST, yes.
Yeah, that's what I thought.
I move to approve the descriptions.
Yeah, can we do them as a batch or do we have to do them individually?
You
We,
can
because,
go with the batch.
okay, perfect, thank you.
Move to approve these job descriptions.
I'll second.
It's moved and seconded to approve the job descriptions. Any further discussion? All those in favor, please say aye.
Aye.
Opposed?
Again,
Passed.
and again, and again.
Excellent.
So
Not there, it says all. Where it
then,
says it's all.
Steve, Lori, what's the next step with that then is to go back to council?
So the next PAC meeting is in May, the second Tuesday in May. They'll go back to PAC. PAC will either approve or not approve for them to be sent to WIS. WIS will do the review, if approved by PAC, send it back, and then we'll still be going through the process of then approving those or not to then move to council.
But council doesn't necessarily have to go along with the recommendation of WIS, isn't that correct?
Correct.
But it has to go to them.
It has to go to them as a matter of protocol.
Do you have any concern this won't pass through PAC to move it on to us?
Of course.
Do we need to show up at that meeting to advocate for that, or is this,
I mean,
a slam dunk?
I think that they would approve them to go back for review.
Let us know.
And that's second Tuesday?
The second Tuesday in May.
Again,
Oh, I'm
there are
gone.
many of us who would want to go along with you and make noise.
Okay, all right. Shall we move on here? New business, limelight recovery, something you're talking about?
Yes, so this is a proposed, essentially sort of like a pilot project with Limelight Recovery. This would be, essentially, they would be providing services, virtual substance use treatment and in-person services through the Indiana Recovery Alliance. This is just, the request is just $5,000. Essentially, I think this will give us an idea about whether this is a good partnership, what kind of outcomes we are receiving, and then could consider continuing or expanding potentially in 2025.
Does this meet part of the metrics for the Indiana health funds?
Yes,
Yes.
this does
Okay.
align with the core
Okay.
service.
And so they'll give us that data from there.
And it is written in this contract here, those requirements and the timing that they're required to provide that. So item 2, reporting and metrics, so quarterly reports, so zip codes of individuals served. They are required to be providing these services to Monroe County individuals, the number of individuals served, the number of sessions conducted for group therapy, and then the number of sessions conducted for individual. So this is still in the 30-day posting to the public, but then it could move on to the commissioners pending board approval at their next meeting.
Do you need action from us or is this just for our information?
So did you want to make a motion?
I move to approve the contract service agreement with Line Lighter.
Second.
All those in favor, please say aye.
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 Opposed? Okay, motion passes. All right. This is a brief discussion of the current fiscal situation at Futures Clinic. Basically, we've had a few scheduling issues down there, which we're going to meet with the staff next week. When I say we, Lori, and anyone else who'd like to come, but Dr. Britton, myself, Lori, and
I'm happy to come.
there you are. We feel like they need some guidance on, and quite frankly, I think the clinic is being underutilized by a fair amount. We're currently not in compliance with the number of people that we need to see, so we just want to turn this ship around while we're early in the year, and some changes are going to be made there. So, and we'll have a brief personnel discussion following the meeting today. Now, specific questions? You have anything?
So the personnel meeting is just separate from the board meeting?
That's
you're
right.
saying?
Because we don't discuss personnel issues in
I see.
a public
Okay.
meeting. Yeah. Nothing else? Okay, the situation is being addressed. That's what you need to know.
So how do we drive patients to the clinic so that they know it's there and they can access it and?
Keeping it open would be a good start. Open to all during its regular scheduled hours.
Personnel available.
Mhm.
Yeah.
I see.
In the past, we haven't had difficulty, I don't think, attracting patients, have we?
No, we have the patient volume, so it's there. It's just a matter of, efficient scheduling and, building some tweaks in there and ensuring that the clinic is open and operating and serving the public.
And we're meeting with the staff so that they understand. I've got a very frank and open discussion with them about, what meeting fiscal responsibilities as well as patient care. I mean, you have to hit that balance. I mean, we understand, I ran a dental practice for, 43 years, and Dr. Britton runs his practice. So we understand what patient care is and how much time you need. You need adequate time to see your patients, but you also have a fiscal responsibility, and we have one to the public that entrusts us with their money and the grant money. And we have certain parameters we have to meet that just aren't being met. I mean, that's as simple as that. And so we have to meet those. And it's basically been mostly scheduling issues. And I know a lot about efficient scheduling. Just need to get that across. Get that across. Okay. What about the DIS coordinator? DIS.
40 hours.
Yes, so our DIS coordinator, wonderful, very hardworking, still covering those 12 counties. She's on the road a tremendous amount of time, spending a lot of time driving back and forth, does consistently, always goes to Terre Haute at least one day a week, but then again, other counties as well. So we did lose the grant funding that was funding our third DIS, which that person left the position around a year ago, was moving back to her original home state of Ohio. So we never refilled that position, knowing that we were going to be losing that grant funding. So we currently have the 2 full-time, but with the amount of comp time and just the work load that's required for the DIS coordinator, the request is to move that position to 40 hours. And then I think that we'll probably want to consider using some of the HFI money potentially to add back in a third in 2025.
How many hours is she currently approved to work?
35.
She's at
and-
35 here.
So she, her jail testing in other counties, at least 2 days a week, she's putting in hours until about 6 or 6:30 at night. So she pretty much always ends up having to leave early on other days to kind of keep her at 40 or under.
Okay.
I'll move to approve increasing her hours to 40 a week.
I'll second.
Oh, it's been moved and seconded to increase the DIS coordinator to 40 hours. All those in favor, please say aye.
Aye.
Opposed? Thank you. Okay, we've got grant gift card policy.
Yes, so currently, the county does not approve of our local dollars here for the purchase of gift cards. However, if we have grants that will allow the purchase of gift cards with the grant funds, the recommendation that I was provided was that the Board of Health would need to create a policy regarding gift cards purchased with grant funds in order for us to be able to.
What are the gift cards?
Are these for incentives?
These are for incentives, for like testing incentives.
And do we have grant funds currently? Like, is this a current issue?
This is a current issue, and there is a little bit of money that was approved by the grant for these. Just can't actually move forward with purchasing those without a formal policy. And need some strict parameters around, for example, we cannot just, if we are partnering or contracting, we cannot just give those gift cards to other agencies and, or personnel with other agencies that we're contracting with. So making sure that we have a reporting system in place within the department who is tracking the gift cards when they are given out and the use.
So do we have a template?
Template, yeah, or do we have something that someone else has done?
Not as of right now.
Okay, so we have nothing to actually look at or,
Because I could draft
Right.
a policy, but I need something like what you just said wouldn't have occurred to me. I don't know what to put in it.
Well, and I think part of the problem is who's gonna be responsible for tracking and then dispersing these when the DIS have patients that they want to provide them to. So who's the position or what's the position that's
What about the
responsible for
DIS?
that?
So are these at work?
Yeah.
That was my
are
question.
they
was,
only used
Are
by
these an
DIS?
STD?
What's that?
Are they limited to STD? I would suggest we ask Miranda to draft the policy. I think she's gonna be the most knowledgeable.
Yeah,
Although, again, she might just, instead of reinventing the wheel, she
I was gonna say,
might see
there are
what
probably
somebody
a
else
whole lot
has.
of other places that have
Yeah.
policies in place that,
And I'm happy, she can send it to me. I'm happy to work with her. I just don't know. Who wouldn't know, how to do it, but I can.
Yes, and I had hoped to have more information kind of drafted. This just really sort of came up. I at least wanted to get it on your
on our radar.
minds. Yeah, thanks.
One comment I have is that if we consistently, other than the job descriptions for that, but if we can, we had a lot of stuff to review tonight, we hardly had any time to review it. So I know you've been really busy and Lynetta is probably as well. But as soon as you can get some of this information out to us, it gives us more time to read it, because it's just, my day is full today already, so I didn't have as much time as I would like to go over the school proposals, although I did read enough before I came in here. So if it's possible, get the information just maybe a little sooner,
Definitely.
especially like minutes.
At least a week was kind of my target, if that is enough.
Yes.
Yeah, a week's enough.
I'm still unclear. We got a notice about the IDOH visit next week and a time, but do you want us participating? I wasn't sure what you want or need from us.
And when you say we got a notice, was that an email
She
sent
sent
to
it,
the board?
oh, that was us, yeah. She sent
So
us
I
an
got
email
this
a
notice?
while back about
Okay,
the
Sorry.
IDOH visit next week. I put it on my calendar.
So is there a
But Lori
certain
sent it.
project that we're really excited about for 2025 that, I mean, they're wanting to hear about? I assume they're wanting to hear about what we're
What we've done.
planning for the funds or what we've done so far, and so what does that look like?
I think one of the exciting projects is trying to develop programming around maternal and infant health. So met with a couple individuals from the state to discuss that. I have talked with Bloomington Mobile Integrated Care about paramedicine services. So I think that those would be one of the programs that we could focus on for 2025.
I really think we need to be focusing also on vaping, particularly in youth, adults as well, because obviously they are as uneducated as the kids are, but the understanding of what this means in terms of health and well-being, and because we know that kids then can influence their parents. Parents very seldom influence their children. Right, we need to be hammering away at the very youngest and all the way up.
And Avery is supposed to be working with Lisa in the schools on vaping specific programming.
We certainly had the Mothers Against Guns and gun violence, and certainly gun education is always imperative, but again, through the schools is part of how we're doing that.
Gun logs, yep.
Yep.
Which the public health clinic did just receive a supply of those from the county to distribute at the clinic.
And whether we're talking to people about, and I would hope every month that we're talking to them about, distracted driving. I mean, that during safety week, what we learned was kids are incredibly sensitive and aware of how distracted their parents are driving and how fast their parents are driving and how it scares the kids. But the kids obviously are not going to tell mom or dad to slow down. So all of those things, again, are things that I think affect the health and well-being of the people in this community. And also about vulnerable users of our roadways, whether it's bicycles or pedestrians. People are just not paying attention, and they think that everyone, and they forget that at least half the population is not driving a great big automobile. So those are areas that for me are really imperative that we start educating our community about.
One comment, Dr. Daniel Milliken has been expressed interest in being on the board. So I can get you his number if I think the next.
We don't have anything to do with that. It goes through the commissioners.
Well, yes, but I thought last time when we were here, you asked me if there was anyone else who might be.
Does he live in the
Interested.
city limits?
Well, it's county.
I'm not
Is it the city that's
sure.
approving this one?
I think this one is, the mayor recommends it to the county council.
county commission,
That's
Or
correct.
County council,
Yeah.
to the county commission.
or sorry, county commissioners.
And he's a Republican.
Yes,
Okay, well,
so,
then,
And he has to go through the mayor's office and the
yeah,
mayor too.
there is a woman, a young woman there. Her name is Crystal Ritter. You want to write
Okay.
this down?
In,
I'll give you her number.
okay,
It's 812-349-4357.
she's in the mayor's office.
349-4.
357.
057,
Yeah,
okay,
sorry. Crystal Ritter.
okay,
And she is the one who I've spoken to there about our request for.
okay.
Okay.
All right,
Thank you.
All right, do I have a motion for adjournment?
That's a move.
Move to adjourn.
Yep.
Second,
All those in favor?
yes.